Hi everyone, my name is Dr. Rogowski, and today I want to talk to you about my social media campaign, which is Braces, not just for a pretty smile. Early prevention can prevent long-term problems. So what's the issue? There are 3 types of bites. Class 1 is a normal, healthy bite. Class 2 is when your top jaw grows faster than your bottom jaw. Class 3 is when your bottom jaw grows faster than your top jaw. In this picture, the back teeth aren't touching because of improper growth. In this picture, the front teeth are not touching because of improper growth. So why is this an issue? I'm going to show you a video now of growth and why improper growth can cause problems.
An anterior open bite is a condition where a patient's top and bottom front teeth are unable to make contact, often including teeth that protrude outwards. Anterior open bites vary in severity and cause. Some factors that can lead to an anterior open bite include thumb sucking and pacifier use in children, airway irregularities, mouth breathing, sleep-related disorders such as snoring and apnea, as well as disproportionate facial bone growth in adolescents and adults. While oftentimes the primary concern of patients with an anterior open bite relates to their appearance, other complications may include speech difficulties, disproportionate wear to the rear teeth, jaw muscle pain, and trouble eating due to inability to bite into food. There are a variety of solutions that can assist with correcting an anterior open bite. Your doctor will work with you to determine a treatment plan that best fits your unique situation and needs.
So as you can see from that video, there are a lot of things that happen when you have an improper bite. As discussed, you have poor eating ability. A lot of times, people present with jaw pain. That can lead to chronic pain or chronic headaches. The misaligned teeth can also lead to speech impediments or facial asymmetries. So what causes this? There are a variety of reasons why this happens. One could be because the person was born with a cleft lip or cleft palate. Frequent use of pacifier after the age of 3 and bottle feeding in early childhood. Thumb sucking causes improper growth. Injuries, tumors, and abnormally shaped teeth can also cause improper growth. And finally, air obstruction. So what can be done? First of all, we can prevent these problems. If people stop the use of the pacifier early or stop thumb sucking and bottle use, they can prevent these problems. They do 6-month checkups. You can see how the jaw is growing and make changes accordingly. If the jaw still grows improperly, you can do early intervention. Thumb stoppers prevent kids from putting their thumbs in their mouths. Correction appliances help the jaw grow properly. Braces can be done, or early surgery can be done when it has to do with tumors or cleft palate. So what's the holdup? If early prevention can be done, why isn't it done? It's simply because of lack of parent education. If early intervention can be done, why isn't early intervention done? It's simply because of lack of funding. What's the plan? Our social media campaign has 3 target audiences. The first audience is the parents with children aged 2 to 13. In this group, we can prevent and influence. Our second group is public health officials. We want them involved in policy writing so that children can get the treatment they need. Last is the lawmakers. Currently, children's braces are not covered under medical care, so we would like that covered. So our goals with our parents. Early ortho to prevent late surgery. Our goals with this group would be education on prevention. We want parents to know about warning signs. We want parents to know when to act and when the growth is not correct. And we want education on treatment options. Our goal for this group is early intervention and prevention. Public health officials. Prevent structural abnormalities to promote childhood and adult success. When children cannot eat properly or speak properly, they may be stunted in their growth. Our goals with this group would be education on the problem. We want them to know the impact that improper growth has on children and adults. We want them to know that there are ways of preventing this. And we want to revisit the current policy. Our goal would be to consider this issue as a public health concern. Finally, our last group, lawmakers. We want lawmakers to allow access to prevention. Our goals with this group are education on the problem. We want them to know the impact that this has and that this is a public health concern. We also want this group to know that there are ways to prevent abnormal growth. Ultimately, we want to change to the current children's dental coverage to include braces when necessary. Our goal is state coverage of necessary orthodontic treatment to prevent Class 2 and Class 3 bites. So to accomplish this, we're going to use 3 different social medias. YouTube will be used for a video like you saw today, which is an educational video on growth. We also want to do videos on prevention and also treatment options. Our audience with YouTube will mostly be parents and public health officials. Twitter will be used for data sharing. We want to get the basic information out about abnormal growth so that parents and public health officials are aware of what a normal jaw looks like. On Twitter, we'll be sharing research and news articles, and we want to cross-promote between our social medias. Lastly, blogs will be used for case presentation. We want to show what early intervention can do. We also want to show what late treatment looks like. Blogs will be used to answer questions and also cross-promote. Our audience in this group will mostly be public health officials and lawmakers. So our social media plan. On YouTube, our goal is to have a monthly post of videos to include growth videos and case presentations. On Twitter, we would like daily posts to include infographics, research, news. We want to be able to interact with our followers, share our YouTube videos, and links to the blog. Our blog will be used for 1 case every week. It will be posted every Monday with discussion questions at the end. And those discussion questions will be answered every Friday. With this, we want to increase involvement of the orthodontic community and increase awareness of growth abnormalities. To evaluate our YouTube, we will see how many video views per month. Our ultimate goal would be 100 views per month. We'll also be looking at how many new subscribers, with our goal being 20 new subscribers per month to our channel. We'll evaluate our Twitter by how many followers. Our goal would be 200 new followers per month. We also will pay attention to how many shares per post. with our goal being 15 shares per post. Finally, we'll evaluate our blog with how many shares of our blog on Twitter. Our goal would be 10 shares per month, and how many participants in the discussion, with our goal being 20 people per post. This is our timeline. We'd like to start our campaign on October 31st of 2019. 1 year later, on October 31st of 2020, our goal is to have 100,000 subscribers on Twitter, 10,000 on YouTube, and 100 on our blog. On October 15th, 2021, we have a goal to have a meeting set up with the Arizona Board of Dentistry to try and set a new policy. On October 31st of 2021, our goal is to have a meeting set up with the Arizona Board of Dentistry and lawmakers so that we can get a change to the current policy so that children can get access to care. No child should have to deal with a bite because of lack of education and funding. Here are my references. Thank you guys for watching my video, and let me know if you have any questions.